This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose
Paano ako gagaling?
There's an ethical issue.
either the
Supposed
second
to
or
Help first or
Medical Dilemma.
Hi, I'm Sunny Del Rosario, and you are tuned in to Medical Dilemma. The big C, or cancer. The mere mention of the word strikes fear in the hearts of most of us. We are aware of its existence and its tendency to hit people of all ages without warning. But most of us, if not all, truly understand what it is and how to fight it. In this episode, we will talk about cancer, its many types, especially those found in women, and protocols and possible cures to fight the disease. Now, joining me for the first segment is Dr. Gil S. Gonzalez, Chief of the Gynecologic Oncology Unit of the University of Santo Tomas Hospital, Benavides Cancer Institute. Later, in the second segment, we will have Dr. Lourdes Blanco Capito, an obstetrics and gynecology specialist of the Cardinal Santos Medical Center and Manila Doctors Hospital. She was also the past president of the Philippine Obstetrical and Gynecological Society. Now, welcome to the show, Dr. Gonzalez.
Hello to all viewers of GNN, and thank you, Sunny, for having me in this show. May is the Cancer Awareness Month, so it's very timely.
Okay, you're welcome, Doctor. Now, since this is the Cancer Awareness Month, maybe it's a good point to start off with, what are the most common types of cancers, especially those found in women?
Okay, for Filipino women, the top cancer would be breast cancer. It's number one. It's followed by cancer of the cervix. The cervix is the lower part of the uterus in the vernacular kwelyo ng matriz. The third is lung cancer, common to smokers, both men and women. The fourth is cancer of the ovary or the eggs of women.
Okay.
Colon cancer, the large intestine, leukemias, thyroid, cancer of the uterus or the womb, cancer of the stomach, and leukemias. So these are the top 10 cancers among women in the Philippines.
Among women in the Philippines.
Yes.
Now, how are these cancers detected these days?
For cancers of the reproductive tract in women, the breasts and the ovary are very amenable to screening. Particularly for cervical cancer, there are what we call primary prevention and secondary prevention. Primary prevention means taking measures to stop the cancer from taking hold in the first place, while secondary prevention means screening or detecting something that might have taken hold of already, but to detect it in the early phase of the disease. So particularly for pap smears, we have the HPV vaccine, since we know that the cervical cancer is caused by a virus called the human papilloma virus. This is a sexually transmitted virus, and there is a vaccine for that. Second would be a healthy, responsible sexual behavior, meaning mutually monogamous
relationships.
Yes.
No multiple partners.
That's correct, Sunny. And the third, you might have heard this, the pap smear, which is a screening tool for cervical cancer. In fact, the pap smear, together with mammography, that I think you'll be discussing later on, is one of the best screening procedures in medicine in general. So cervical cancer is amenable to be detected early, not only that, to be prevented.
I see.
For cancer of the ovary, which is the deadliest cancer among women, there are no early symptoms and there are no early signs. So it is what we call a silent cancer. So it's only through a regular gynecologic checkup or annual medical checkup that ovarian cancer may be detected. Of course, breast and cervical cancer is also being screened in the course of a routine annual checkup for a woman.
When you mentioned deadliest, how high are the stakes, when a woman...
Well, it has something to do with the proportion of women with ovarian cancer who die.
Okay.
For example, for cervical cancer, in advanced countries like in the US, in North America, very rarely would women die of cervical cancer. In our
I see.
country, it's about half. But for
50%.
ovarian cancer,
Okay.
easily 75% or three-fourths of women diagnosed with ovarian cancer would eventually die. So that's
Okay.
how
That's a-
lethal it is, because it is a silent cancer.
Mhm.
When it is detected, generally it's already in the advanced stage.
In the advanced stage.
Yes.
Why is it so difficult to detect this kind of cancer?
Because there is no pain associated
no
with
pain.
ovarian tumors.
Unlike other types of cancers, like cervical cancer.
Yes, for cervical cancer, there might be bleeding, there might be discharge. For uterine cancer or cancer of the uterus, there might be bleeding after the menopause or towards the menopause. But for ovarian cancer, there is no
There's
early
none.
symptom.
No signs, physical
sign.
signs that can be observed.
The woman might just notice her tummy getting bigger, and by the
Okay.
time, there is already a well-established cancer.
I see. And you recommend that you try to detect these kinds of cancers during the annual checkup.
For the general population, that would be through an annual screening. There's what we call familial ovarian cancers. This is something to do with the genetic makeup and hereditary predisposition of women in that family. You might have heard of BRCA1, BRCA2 related
Yes,
to
yes,
Angelina Jolie. So women in the family who are positive with that genetic mutation would be very high risk. So in that case, the guidelines would be much different. It would be more strict and probably more frequent.
So if you have that, what do you call a mutated strain or gene?
Yes, that's correct.
Okay, what are the chances that you will develop
I think the latest
cancer?
figures are 45%, although in
45%.
older literature, as high as 80%.
80%.
Yes. Just for our layman to understand, these mutations are like there is a defect in the brake of the car
Okay.
that prevents the cell from multiplying. So if that mechanism is disturbed, then the cell keeps replicating. Even if it's an abnormal or a cancerous cell, it keeps replicating because it lost the brakes.
And that develops into the cancer.
Yes, that's essentially what cancer is, uncontrolled growth.
I see. Now, supposing a patient or a woman suspects that she has some type of cancer, so what should she do now?
It depends on what her symptoms or complaints would be. If it's for the breast, of course, we examine the breast. If it's for the cervix, we do a complete physical examination with emphasis on examining the tummy and doing what we call pelvic examination, including taking a look at the cervix and feeling for the cervix and the uterus and the ovaries, and doing the appropriate pap smears or biopsies as necessary.
As necessary. I heard women say that mammography is a painful procedure. Well, I don't know, but is it true?
I haven't had one done yet, but I'm aware that the breasts are compressed for a few seconds, and that's what causes the discomfort. Okay. But
Okay,
I think that there are now newer machines which do away with that compression.
So it now becomes a more comfortable
It's a
procedure.
more comfortable and more convenient test.
Okay. Now, supposing the patient gets confirmation that she has what you call a tumor, okay, what should she do now, or what should the doctor prescribe?
Generally, when a tumor, especially a cancer, is suspected, we would establish first. We find out whether it is a cancer or not. There are many tumors or masses in the body. Not all of them are cancer. But
Okay.
it's very important at the outset to find out whether it's cancer or not, because the treatment would be dramatically different for cancer. It would be more aggressive. So a biopsy would be done generally, especially for accessible areas, for the breast, the cervix, some rarer types in the external genital area of the woman. A biopsy can easily be done for a suspicion of vulvar cancer.
Okay.
So generally, a biopsy is performed. If the organ in question, like the ovary, is not accessible for a direct biopsy, there are imaging modalities like ultrasound or CT scan, MRI, to find out the characteristics of the tumor, which could not be found, which should not be known by by feeling or by ordinary examination. So the imaging procedures would give us a deeper insight into what's the makeup of that particular tumor.
Okay. In terms of, well, it sounds like cervical cancer is the only type that has a known cause.
Yes, it is.
Yes.
I would venture it's the cancer where we know the most about.
We know the most about.
Yes.
Okay. So it's something that we can actually manage and
Not
recover
only
from.
manage, but prevent, because we
And
know
prevent.
what's causing it.
I see.
We can take measures to prevent the cancer.
Okay. Now, supposing other types of cancers are considered, what preventive measures are available?
Well, the screening methods that are advocated are for not all of the top 10 tumors have screening. It's only those with the cancers that may be accessible, and the test would have a what we call a cost benefit ratio, like breast cancer, of course, mammography, cervical cancer, pap smear, and the what we call the visual inspection of acetic acid. For ovarian cancer, really, there's no screening, but
There's none.
we do ultrasound as part of the annual screening.
Yes.
For cancer of the uterus, ultrasound would also be a tool, but we would be very suspicious of cancer of the uterus if a woman has abnormal bleeding, meaning bleeding outside of her regular periods if she's young,
Yes.
and bleeding at any point after her menopause.
Is there an age range that is affected by, let's say, cervical cancer?
For most cancers, the incidence would go up after age 40.
After age 40?
Yes, so that's true for both males and females. Cancers go up, incidence go up after age 40. But there are some cancers particular to younger people, like kids. They have
Yes.
some forms of leukemias that are more common in their age. There are types of ovarian cancers more common in the younger age. But in general, age itself would be a predisposition for cancer, especially after the age of 40.
Okay.
We're not saying cancer cannot happen before 40. It does. But the incidence goes up after 40.
I see. Okay, well, thank you so much for all that information, Doctor. It's now time to take a commercial break. We'll be right back after a few words from our sponsors.
Many of our products were designed to be used in industrial and medical economy.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like there are other senses, right? So you hear it, you see it, and then you can smell the fireworks.
Now put it quickly by asking, you're already practicing.
You need a word here what can be words can inspire and words can destroy. Choose yours. Okay?